Good morning, everyone, and thanks for joining us today to talk about the Telehealth Trailblazers grant opportunity. Telehealth has emerged in the wake of the COVID pandemic as an important tool in addressing our country's healthcare needs. We believe that libraries are uniquely positioned to facilitate telehealth services in underserved and rural communities by providing safe, private, and reliable spaces, as well as access to adequate technology and technical support. Facilitating these services in a library setting or through a lending model is a new and emerging practice, and Idaho has the opportunity to lead the way in this exciting new field. The ICFL, in partnership with the Blue Cross Foundation for Health, will be awarding a total of $40,000 in grants to public and tribal libraries across Idaho to pilot a variety of telehealth projects in their communities. I'm going to cover a lot in today's webinar with the intent of giving you the information you need to submit a high-quality application. You are also welcome to reach out to me after this webinar with any questions you might think of later. Here's an overview of what we'll be covering today. We'll talk a little bit about some upcoming additional funding opportunities. We'll touch on what it means to be a trailblazer. We'll define telehealth and talk about the library's role in providing telehealth. We'll touch on grant timelines and important dates. And we'll also dive a little deeper into what it means to be an eligible applicant, qualifying projects, and allowable activities. We're going to talk a little bit about some important information you need to know when submitting your grant application. And then we'll end talking about selection criteria and how to submit a strong application. The questions and answers from today's live webinar will be provided in writing, and that document will be provided on the website alongside the copy of this webinar today. As we're talking today about telehealth, the Telehealth Trailblazers grant, we want you to be aware that the ICFL may have additional opportunities in the upcoming year. If you have a great project in mind, but it doesn't quite fit with the timing or scope of this particular grant, or if your project isn't selected for funding this time around, we encourage you to continue developing your project as we anticipate other opportunities in the near future. Keep in mind that the two additional initiatives that we have listed here are pending final approval of the state's FY23 budget, which is currently under review by the Joint Finance and Appropriations Committee. While we're fairly confident that these items will receive approval and be ready to launch by late summer or early fall, we can't make any hard guarantees at this stage in the process. So the two opportunities that we have coming up are the Capital Improvements Grants, and with that opportunity, the ICFL will be awarding out $3.5 million in funds through a competitive grant to support library capital projects. These will be multi-year grants that support one-time investments to improve library buildings, and those improvements have to enable work, education, and health monitoring in communities with critical needs. The other project we have coming up is ready-to-use privacy pods. The ICFL will be partnering with the Department of Health and Welfare to purchase and install up to 25 pre-built privacy pods in libraries across the state. Details of administration and the timeline are still under development, and we will be announcing more information about that opportunity as it becomes available. Before we dive into the details of the grant, I want to talk a little bit about expectations, telehealth, and the role of libraries. There's a reason this grant is called Telehealth Trailblazers. Telehealth is a new concept in general, and telehealth in libraries is an emerging practice with relatively few established models to draw from. The goal of this grant is to recruit and fund a few courageous libraries who are willing to trailblaze into this unexplored territory and identify viable paths and models for future libraries to adopt. I want to take a few minutes to go through the definition of telehealth, as I think it will help applicants when putting together their project proposals. For the purpose of this project, we are defining telehealth as health care provided at a distance using telecommunications in real time. Since this grant is designed for libraries, the most important distinction I want to point out is that telehealth is health care, which means it is provided by a licensed health professional, not a librarian. Furthermore, telehealth is not a collection of health information or resources. Simply providing access and guided reference to medical books or information does not qualify as healthcare. Secondly, telehealth is provided at a distance using telecommunications. While it would be lovely if your library hosted a doctor for regular office hours, this would not qualify as telehealth and thus would not qualify for this grant. In order to be telehealth, it must involve physical separation between the patient and the provider who are connected through the use of technology. Finally, for the purpose of this grant, the connection between provider and patient should occur in real time. In other words, the patient and provider can have a spontaneous, interactive conversation that does not involve significant delays. An example of something that would not qualify as telehealth would be a patient uploading health data on a library computer for later review by their doctor, or accessing test results through their MyChart account. So with this definition in mind, how exactly can libraries provide telehealth services to their communities, and what is the role of libraries in these projects? The role of libraries in telehealth is not to serve as the healthcare provider, but to facilitate and enable this connection between patients and providers. There are a variety of ways that libraries can do this, and the purpose of this grant is to explore and develop models that will work for different needs and situations. I've listed two very basic models here, but we anticipate that our group of Trailblazer libraries will come up with other creative solutions or variations as well. So the first model on the slide is on-site telehealth. And in this model, the library would establish a safe, reliable, and private space inside the library that can be scheduled for telehealth uses. The library would equip the space with sufficient hardware, software, technology, and furniture. And perhaps most importantly, the library would provide on-site technical support and assistance for using the technology. That human touch between the librarian and the patient, helping them get comfortable and situated, is going to be very important. The other model is the lending model of telehealth. In this model, patrons check out the technology they need to use at home. The library maintains and updates that technology, and again, the library provides that really core important component of technical support and assistance. So now that we've established a baseline of what telehealth is and where libraries fit into the picture, I'd like to dive a bit more into more detail regarding the Telehealth Trailblazers grant opportunity. First, I want to quickly review the timeline and major milestones for this project. The grant application was released on February 7th, and it is due in a little less than a month from today's webinar on March 14th. We anticipate, if all goes according to plan, that we will be announcing funding decisions on April 1st, and I want applicants to know that you will receive word from us one way or the other, whether you are selected or not. We don't intend to leave you hanging, wondering what the outcome was. We expect that funds will be dispersed into grantees' bank accounts in early April, and we'll be hosting a grantee orientation and kickoff in late April for those who are selected to participate. The project period will run from April 1st to December 15th. Please note that this grant has a relatively short project period, and grantees should be prepared to work within this time frame. Selected grantees can begin incurring costs as soon as they've signed the paperwork, even if the funds have not entered their bank account yet. And grant funds should be fully expended or obligated by December 15th, but we do have some flexibility should a grantee encounter significant delays or setbacks. I also want to note that grantees will be expected to participate as part of a cohort, but the ICFL intends for these activities to be supportive and fluid in nature and minimally disruptive. This will likely involve occasional Zoom chats to share challenges and successes, a dedicated listserv for asking questions of one another, and ongoing support and technical assistance from the ICFL. Finally, Grantees will also be required to submit an interim and final report and should be prepared to keep sufficient records, including receipts and time and effort reports. And we'll go over all of these items in greater detail at the grantee orientation meeting, but I did want everyone to be aware of these stipulations as they're deciding whether to apply for the grant. Next, I'd like to talk about who is eligible to apply for this grant. There's a lot of information on this slide, and we'll go through it one piece at a time. Eligible applicants must be either a public or tribal library in Idaho, and public libraries may be either a city or district library. If a public library has multiple branches, we are currently only allowing one application per legal entity. Additionally, eligible applicants must serve a rural or remote community with limited access to healthcare services. So I'm going to break that down for you a little bit, as some folks may not be sure if they're eligible. When we talk about what it means to be a rural or remote community, we're not putting specific parameters around our definition of rural because we realize that the needs and barriers for every community are different. Instead, we are thinking of this in terms of how a community's location and resources impact its residents. In general, to qualify as a rural or remote community, the number of services and amenities within the community would be limited in number, scope, or hours. And if a service or amenity is not available or adequate in that community, residents would have to travel to another location where the service is available, and such travel would have negative impact on the residents' time and resources. I also want to break down the phrase limited access to healthcare services for greater clarity. For something to be a healthcare service, it must be provided by a trained and licensed healthcare provider. This could include doctors, nurses, pharmacists, counselors, psychiatrists, physical therapists, etc. Examples of services would include health clinics, primary or urgent care, specialty care or consulting, emergency rooms, pharmacies, outpatient services, and behavioral health and counseling services. And finally, when we talk about limited access, we generally mean that the service is either completely unavailable or it exists, but it's inadequate to meet the needs of the population. For example, a community might have one small health clinic with a single doctor, but that facility simply cannot keep up with the demand or the need of the community. Now that we have an idea of who is eligible to apply, I want to talk about the types of projects that would qualify for funding. We will consider projects of all sizes within the indicated funding range. Projects need not be large in scale or scope, but they should be aligned with the needs and challenges of your specific community. A small library may be able to make a significant impact with only $1,000. Additionally, we want to establish functional models and best practices for a variety of libraries and needs. For these reasons, we encourage applications for projects of all sizes and scope that meet the goals of the grant. In order for a project to qualify for funding, it must facilitate a direct connection between patients and providers. This can be accomplished in a variety of ways using a variety of models. And there's significant flexibility in exploring how libraries might make this work. However, this direct connection is a core component of the project. Proposals that do not include or address this requirement will be disqualified from consideration. I also want to note that grant funds may be used to purchase related materials and resources as part of the project, such as expanding the library's collection of medical books, subscribing to a health database, or purchasing medical equipment for use on site. However, these related expenses must be part of a larger project that includes the requirement for facilitating a direct connection between patients and providers. Because the grant is funded by the Blue Cross Foundation for Health, we have significant flexibility in how funds are used to meet the goals of the project. There's really only one hard restriction, which is that grant funds cannot be used to support the general operating costs of the library or its partners. In other words, the grant must be used to support project-related expenses. I've listed a few examples of allowable activities here, and you can find an expanded list on the grant webpage. As you're developing your proposal, please keep in mind that the spaces, resources, and technology funded through this grant can absolutely be used to support other library programs and needs, as long as it remains available for telehealth services and telehealth services are given priority. So for example, if the library installs a privacy pod or builds a new private room, those spaces can be used for other purposes like a quiet study space, telework, or meetings, as long as priority is given to telehealth services and scheduling. Here are some important things to keep in mind as you work on completing and submitting your grant application. The grant is due on March 14th at 11:59 p.m. and the link to the grant application is located on the grant page under Grant Application and Resources, which you can see in the screen grab here with the big blue arrow pointing to the correct section of the website. Please note that the grant application form cannot save your progress. You will need to have all of your information and responses ready when you sit down to fill out the application. We recommend drafting your responses in a Word or other local document first. As you're completing the budget table, please round or adjust your budget line items as necessary to ensure that your total budget is in an even $100 increment. And finally, a copy of the application will be sent to the email addresses included in the application. If you do not receive a copy, please reach out to us so we can ensure your application was received and there are no issues with the email address you provided. Make sure to also check your spam and junk folders as well, because this email will come from JotForm, not from the ICFL. And finally, don't hesitate to reach out to me if you have any questions about completing or submitting the grant application. And I want to end the presentation today talking a little bit about selection criteria and how to submit a strong application. All qualifying applications will be reviewed by a committee and scored on a scale of 0 to 100. You can see how many points are possible for each question on the application form, and you'll want to tailor and prioritize your time accordingly. Also, we realize that these are pilot projects. And as such, we understand that the logistics and the budget breakdown may change and adapt over time as the library learns and explores their new project. That being said, a strong application will demonstrate a real need in the community, and it will provide clear objectives related to addressing that need. It will also have a realistic starting point. Even knowing that the project may change over time, we want to see that you have a clear idea of where you're going to start. And finally, the proposed project must be feasible for the size and capacity of the library and its staff within the time frame of the grant. I know that we just covered a lot of information. If you have any questions about anything presented in this webinar today, please don't hesitate to reach out to me. My information is provided here on this slide. Additionally, questions and answers from the live webinar will be provided in writing on the website and will be linked next to the link to the recording of this webinar. We appreciate your time and we look forward to reviewing your application.